CMS has updated the CPT codes for remote patient monitoring for 2024. In this video, we'll discuss everything you need to know so that you can properly code and bill for this program. Hi, I'm Seth from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for value-based programs like RPM. If you'd like a reference guide for the RPM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. For 2024, there is one major change to RPM that affects rural health clinics and federally qualified health centers only. For the first time, RHCs and FQHCs will be able to bill for remote patient monitoring services. There are also updated reimbursement rates for the RPM CPT codes. Keep in mind that the codes are based on national averages, which may vary in your area. For the exact current rate based on your location, visit the Physician Fee Schedule website. CPT codes for remote patient monitoring are broken into two categories: device-based and time-based. And there's now a separate requirement if you're a rural health clinic or federally qualified health center. Let's start with the device-based RPM codes. The first is CPT code 99453. This code is for the initial setup of the provided device. To bill for 99453, a patient must transmit a minimum of 16 days with readings from a provider-supplied device. This is a one-time code that can be billed after the 16th day with readings. The readings do not have to occur within one calendar month, nor do they need to be 16 consecutive days. 99453 can only be billed once per device. If a patient is given multiple devices, they must be billed with the code 99453 on different months. The current national average reimbursement for 99453 is $20. The other device-based code for RPM is CPT code 99454. This code is for monthly monitoring of the provided device or devices. A patient must take at least 16 daily device readings per month in order to trigger this code. This code can only be billed once per month, no matter how many devices the patient is using. If the patient has multiple devices, you can total the daily readings from those devices to reach 16 daily readings. 99454 has a current national average reimbursement of $47. In this year's final rule, CMS clarified that both 99453 and 99454 must meet the 16-day requirement mentioned above. This was inferred in the past but made clear in documentation to ensure compliance. Now let's look at the time-based RPM codes. First is code 99457 for at least 20 minutes of non-face-to-face RPM services per month performed by clinical staff. Clinical staff can be a certified nursing assistant, certified medical assistant, or higher. 99457 has a current national average reimbursement of about $48 a month. There is an add-on time code 99458. 99458 can only be billed concurrently with 99457 and is for an additional 20 minutes of RPM services. It is billed at 40 minutes and pays about $39. 99457 and 99458 combined can average about $87 for those two codes. 99458 can also be billed an unlimited amount of times per calendar month, so at 40, 60, and 80 plus minutes. Finally, let's talk about remote patient monitoring for rural health clinics and federally qualified health centers. The 2024 final rule allows RHCs and FQHCs to bill for remote patient monitoring for the first time under the code in General Care Coordination GO511. RHCs and FQHCs can bill for only 20 minutes of non-face-to-face RPM services per month. The reimbursement average for G0511 is about $72. Unfortunately, RHCs and FQHCs won't be able to receive the device reimbursement for 16 readings a month, but GO511 can now be billed multiple instances per month, so it can be billed twice at 40 minutes of RPM services per month or in conjunction with a chronic care management program. This is great news and will enable clinics and centers to create more comprehensive chronic disease management programs. So there you have it, the 2024 updated CPT codes for remote patient monitoring. If you'd like to learn more about RPM, its rules and regulations, or its billing codes, watch more videos on our channel or visit our Learning Center. There's links in the description below. And don't forget to download your free reference guide for the billing codes we discussed in this video. Please like and subscribe. Thanks for watching.